Hello, I'm Valerie Austin. I'm an author, journalist, and hypnotherapist. I'm the author of 7 books, including Self-Hypnosis Made Easy, which was out last year, and you can buy it from Amazon or in the bookshops. In the book, there is a terrific hypnotic suggestion called the orange liquid, which promotes the immune system and release of stress and negativity for anyone listening to this interview. You can get it free on my website, Immune Boost for You, which is the number 4.com. or my Facebook, Valerie Austin, HYP. Welcome to the Cutting Edge Medicine with Hal Blatman, MD. For the many who have chronic pain, whether it is migraine, low back pain, foot pain, or pelvic pain, since it is there, how do you figure out what really causing it and what has to happen to make it go away? The answers are not what we have been taught. Most of the time, it's not the disc, not a pinched nerve, and inflammation is not what we think. My guest today is Dr. Hal Blatman. Dr. Blatman is a board-certified practitioner of integrative and holistic medicine, completed 2 years of training in orthopedic surgery. He later studied ergonomics during his residency in occupational and environmental medicine for American Board of Integrative Holistic Medicine. Carpal tunnel. How do I know I have it?
Most people with carpal tunnel syndrome wake up with their hands and fingers numb and maybe in pain, and they shake their hand to wake it up. They go to their doctor and complain about that, and the doctor may send them for an EMG test. That's where another doctor puts needles underneath the skin in your forearm and in your hand and sends electric impulses down your hand to measure how well the nerves are working. And if the nerve, the median nerve that goes through the carpal tunnel is injured, this test reflects it. There's a much easier way to tell, and you can tell at home. Just sit on a table with your elbows on the table and your arms bent and your forearms straight up in the air and drop your wrist so it's bent about 90 degrees. Just flexed forward, palm down. If your index, thumb, and long finger go numb or your symptoms increase during the next 45 to 60 seconds, you can bet there's a good chance you have carpal tunnel syndrome and that nerve has been injured that goes through your wrist.
What causes it?
Well, there are different theories for what causes carpal tunnel syndrome, but basically something has to injure the nerve as it goes through your carpal canal. The most predominant theory is that if you use your fingers for repetitive motion and you open and close them a lot, those tendons go through this carpal canal and they get inflamed because they are doing that a lot. And if they get inflamed, it makes them swell a little bit, and there's no extra space in this carpal canal, so the nerve, the median nerve, gets squished and pushed on, and that causes the injury that caused the symptoms. Well, that's been the predominant theory for many years, and as a result of that, there's a surgery we'll talk about in a little bit that has been used for many years to treat it. But if during that surgery you send the cover of these so-called inflamed tendons off to the pathology lab, there's no evidence of inflammation and inflammatory cells to support that theory as the basis for carpal tunnel syndrome. So there's 2 others that we'd like to talk about. One is, in order to use your fingers in a repetitive way, you have to hold your wrist still enough to know where everything is, and to do that, that requires a sustained contraction of your biceps muscle. Well, the biceps muscle may end where it attaches up by your elbow, but the fascia that goes through that muscle goes all the way down to your wrist. And as the biceps fascia tightens, your forearm fascia tightens, and then the ligament that goes across the palm side of the carpal tunnel also tightens. And it's not that the structures inside swell and don't have room, it's more that the canal itself closes down and squishes on the nerve. There is a way to treat that. We'll talk about that in a few minutes. Let's talk about the third theory. And the third theory is that many people, unbeknownst to them, use their hand as a hammer through their lifetime and use their palm to beat on things, to adjust things, to loosen things. And that creates an injury between the ligament that goes over the carpal canal and that nerve that goes right underneath it. And that injury makes stickiness between the nerve and the ligament so that now when you open and close your fingers, the nerve gets tugged on. And the nerve that gets repeatedly tugged on is not going to work so well, and you're going to start to have symptoms that are carpal tunnel syndrome.
How do I make it go away?
Well, if you believe in the first theory, then you go to a surgery that cuts the carpal ligament that goes across the palm side of your wrist. And that surgery has a few weeks of recovery time, and 50% of people do well, and 50% of people don't do so well. And depending who you read, about 30% of people have a consequence that leaves them with pain or disability or problems for the rest of their lives. If you pay attention to the second theory of the fascia has tightened and so has the carpal ligament tightened, then there are some stretches that have been described in the osteopathic medical literature back in the mid-1990s that teach you how to stretch your biceps muscle, teach you how to stretch your forearm, teach you how to put your hands or your partner's hands on the ligament itself and force it to stretch. And we've described those stretches in my book, Winner's Guide to Pain Relief. There's a nice section on carpal tunnel that describes how to do this. And the articles in 1990s showed that you can actually convert someone who has a positive EMG test, the so-called gold standard for proving you have carpal tunnel syndrome, and watch that test convert to negative. Those stretches alone help a lot of people make their carpal tunnel symptoms go away. The third theory, talking about how we use the hand as a hammer and we have an injury between the ligament and the nerve causing adhesions or stickiness, we actually do a needle surgery for that. And we take some Novocaine, we make the skin numb, and we thread a needle between the nerve and the transverse carpal ligament, watching this under ultrasound so we know the needle's in the right place, and inject fluid so that we can separate the nerve from the ligament and get rid of that stickiness, those adhesions, and that scar tissue. And by the time we're done with that, the nerve can move freely in the canal as you open and close your hand. Your recovery is pretty minimal. A couple more days with your brace, and your nerve and your hand may recover just with that. We have about a 90% success rate in that, and 30% of those people end up needing a second procedure. We have no bad results. And so we know that that theory also holds some water and can contribute to what's causing carpal tunnel syndrome.
We're about out of time now, and this has really been very interesting. I want to thank you, Dr. Blatman, for a fascinating discussion. Pain is not what we thought, it is not what we think it is, and most of all, it can go away. For more information, check out www.blatmanhealthandwellness.com. That is www.blatmanhealthandwellness.com, where you can learn a lot of self-help and get information about Dr. Blatman's Saturday morning talk via Zoom and private sessions. You can also purchase his popular book, Winner's Guide to Pain Relief, and the rubber ball that goes with it. Great for the do-it-yourselfers who wants to get their fascia in better shape and get out of pain. When travel is allowed again, he has an office in New York City and can also see you in Seattle. His main office is in Cincinnati, Ohio. His telephone number is 844-282-8900. And if you'd like to look at getting yourself in order again and getting some stress relief, you can always go on my free site and download Orange Liquid. But thank you so much, Dr. Blatman. It's been very interesting because I've been worried about carpal tunnel because I was worried I was getting it, but giving that exercise has been very helpful. Thank you very much.
You're so welcome. Thank you.